Menopause or end of childbearing age is a very important shifting phase in a woman's life, and that normally happens in late 40s or early 50s in most women. Many women even wouldn't notice any changes in their body, but some women they may face a lot of complications and issues during this shifting phase, like feeling hot, suffocated, excessively sweating, irritability, even high blood pressure, and so many other issues as well. If your menopause goes naturally, your body has time to adjust itself with the changes in your hormones in your body. But some women, unfortunately, they are forced into early menopause because of certain conditions like uterine fibroids, especially when you have got a lot of excessive bleeding, abnormal bleeding, and your surgeon advises you to remove your uterus by doing hysterectomy. So that is considered as an early menopause that you are forced into. There are other conditions like ovarian cysts, adenomyosis, even uterine polyps, even PIDs or pelvic inflammatory diseases. I mean, there are so many reproductive issues that women has to face, and sometimes she hasn't been left with any other option but the removal of their reproductive system or the uterus, and that can put that women at more risk of developing certain conditions, especially high blood pressure or cardiovascular diseases. We have seen in the last 15-20 years that the number of cardiac patients, especially in women, has increased. Previously, I mean, there were more men involved or having these kind of cardiovascular events, but now even women are also being reportedly with so many cardiovascular conditions like high blood pressure and angina and various kind of complications. Also, if you are into early menopause, or if your genital organs are removed well before you reach to the right time, say sometime even in your 30s as well, again you are at risk of, as I've said, cardiovascular diseases, osteoporosis, which is the weakness or fragility of your bones as well. Also, there's a good chance of putting on weight increases as well. Also, a lot of stress and emotional traumas are there as well with that. Even some women, they develop overactive bladder or bladder disorders as well. So if you let your body move into new phase from childbearing age into menopause, naturally your body has time to adjust itself. But once you are forced into shifting from one phase to another, especially by doing surgeries or removing your uterus, you are putting yourself at more risk well before on time. So it is advised that before you go for any surgeries, you should try some alternative or complementary remedies and see if your body can improve naturally. And there are a lot of remedies, like I would show you some medicines, like even one of the medicine in homeopathy is known as Calcarea carbonica, Apis mellifica, especially for women who've got a lot of cysts in their bodies, PCOS conditions, or even edema or swelling in the body. There's a biochemic medicine called Calcarea flow, which is primarily used for abnormal growths, any abnormal growths anywhere in the body, so it can help dissolve those growths, especially in cases of adenomyosis or uterine fibroids, or even for uterine polyps as well. Also, there are so many natural plants like ashwagandha, sage, red clover, soy, black cohosh, even primrose. So there are so many natural options available for you to try first. And if you don't feel good, then yes, you have got the last resort to go for any surgical procedures. But if you take a surgical procedure as your first option, you're putting yourself at more complications and early complications of postmenopausal phase, like osteoporosis, cardiovascular diseases, weight gain or obesity, and so on and so on. So if you need any help, you can contact us. You can get some advice and take natural remedies according to your peculiar sign and symptoms. Thank you. Bye.